thank everybody for joining me here. And I'm here today in Union Square, where we have the great, on a regular basis, Union Square Green Market. And that's one of the 51 green markets in the 5 boroughs that now accepts food stamps, EBT cards, because of the work that I've done as Speaker of the City Council. And just to put it in perspective, the first year I was Speaker of the City Council, there was about $1,000 worth of food stamp sales at green markets in the city of New York. Last year, there was over $821,000 worth of purchases using EBT and food stamps at green markets, and the vast majority of those food stamp dollars were spent on the healthy food sold at green markets. This is really important because it means our efforts of opening up access to healthy food, educating people about healthy foods, means that families at all income levels are able to purchase fresh fruit, fresh produce, fresh healthy foods here in Union Square, but also in their own neighborhoods across the city. This is just one of the steps I've taken as Speaker to improve access to healthy food. I've passed legislation with my colleagues that's brought at least 500 new fruit and vegetable carts, green carts, to food deserts across the city. I've helped create and implement the Fresh program, which used zoning and tax incentives to help open and expand more than a dozen supermarkets in neighborhoods that didn't have any or only had a few supermarkets. Through these and other efforts by the city, we've seen childhood obesity on the decline, but clearly more needs to be done. Because even with obesity amongst children headed in the right direction, still, obesity amongst 5 and 6-year-olds remains at 18.3%. That's 18.3% too high. Among 7 to 10 years old, it's even higher, 22%. And we know that children who are obese are much more likely to battle obesity their entire life. So stopping childhood obesity is really important as it relates to people's overall health in the long term. So we need to take action to get the numbers around childhood obesity even lower. And remember, we need to remember in our work that even a drop of a few percentage points means thousands of healthier children today, and thousands of healthier adults in the long run. That's why today I'm outlining a 5-point plan for healthier children in New York City. A plan that focuses on childhood obesity, asthma, and other ailments that can keep children out of school and put them on the path to even more serious health problems as adults. 1, under my plan when I'm mayor, the Department of Health would be charged with creating a nutritional standard for meals that are marketed specifically to children. Again, creating a standard for what can be or can't be a children's meal in the 5 boroughs. So if a restaurant or a food establishment in New York City that is already required to post calorie counts, if that restaurant wants to market meals to children, they're going to have to make those meals meet requirements. Meet healthy requirements for calories, sodium, and saturated fats. Doesn't mean they can't sell it, but if you're going to say this is a meal for children, you have to make sure it meets the kind of health standards we want for children. We know that fast food and chain restaurants provide a low-cost alternative for many families, and that's can be a good thing. But that doesn't mean that low-cost alternatives for families have to, by definition, mean unhealthy alternatives for families. When I'm mayor, the health department will work with all of the stakeholders, nutritionists, doctors, and the restaurant industry's members to put in place new standards that will ensure the healthiest meals for children without increasing costs to their parents and guardians. I think a good place to start for where this standard could be would be the standard that school lunches are required to meet under the FDA school school meal guidelines. Those requirements of the FDA: no more than 650 calories, no more than 7 grams of saturated fat, and no more than 740 milligrams of sodium. And if you look over here, you get a sense of this is a USDA standard for school lunch on saturated fats. You'll see Taco Bell there, which, you know, for Taco Bell, they're not doing so bad around saturated fat. Applebee's, and this is in their children's meals, right? Not all of their food. Applebee's is having a big problem. Their children's meal is way more than the USDA thinks a child should have in one meal for saturated fat. Fridays, Outback is having an enormous. They're the outliers here, clearly in saturated fats. Outback, and you see, similarly, if you go over here to calories, USDA 650, Taco Bell 780, Applebee's children meal is over 1,200 calories. Fridays is over 1,000 calories, and Outback is almost 1,000 calories. In sodium, USDA is here. None of these entities, Taco Bell's, Applebee's, Fridays, or Outback, none of them are, quite frankly, anywhere near what the USDA thinks the sodium level should be in a child's meal. So these are significant problems that we're going to address moving forward. Now, clearly, by what I'm talking about, we're not going to limit parents' choices. You'll still be able to order whatever you think is right for your children. But we're saying that companies can't spend millions of dollars on marketing or include items on children's menus if those foods clearly are going to lead to obesity, which could lead to diabetes or other diet-related illnesses. Second, we're going to double the number of schools with access to full-service, school-based health centers. I can tell you from my time as health committee chair before I was speaker, having school-based health centers provides a comprehensive set of services to students, and these are students who may not otherwise have access to regular health care. These type of centers provide preventive care to asthma management, some have mental health care. They are an incredible resource that we know helps make children healthier. If you want to take a break. These school-based health clinics, they also have a proven track record of helping to decrease absenteeism, reduce teen pregnancy, and promote academic achievement. Because obviously children who are in school more, aren't missing school because they're sick, do better. And children who are feeling healthier when they're in school are obviously better able to pay attention and excel. And because children can get care while they're in the school environment, they also make it easier, which is really important, for working parents who would otherwise potentially have to take time off from their job to take their children to medical appointments. Best of all, the operating costs of a school-based clinic, their operating costs are less than $100,000 more than what you pay for the mandatory school nurse in a school. So this is a way to really expand services without spending a lot more money, because that is by law required that the school nurses, with not much more, we're really going to get more children, more care. 3, gym classes. Now, they might not be everybody's favorite memory of school. Wasn't mine, wasn't very good at it, but they're incredibly important. Even though physical education is required by state law, talk to New York City parents. They'll tell you that in their schools, the offering around phys ed may not really be happening, and if it's happening, it might not be happening in the right kind of a space for there to really be the kind of activity you want children to be a part of. As mayor, I will require that all new schools be constructed with appropriate physical education space. If we're going to tell children and parents that they're going to have activity in school, we need to have the right kind of spaces for them to actually be physically active. We can do that moving forward with every new school we build. My Department of Education will also help existing schools that may have limited space identify creative partnerships with community groups where they could help utilize their space for physical education instruction. Some principals in the city have creatively already begun to do that. We need to have someone in the DOE who's going to help facilitate that, get more principals able to do that. That might mean partnering with organizations like the New York City Roadrunners or other groups that can help get children active. And to ensure that physical education is a real priority for all schools, I'll require that physical education be factored into school report cards. 4, to ensure that hunger does not interfere with learning in schools, and there is significant statistical data that shows that children who are hungry in school do less well in school and have a much harder time learning and paying attention and staying focused. So to ensure that hunger doesn't interfere with learning in schools, I will expand school meal options to make sure that every child who needs it can have regular access to free and healthy meals in our schools. That means making the call I have long had for expanded breakfast in the classroom a reality by mandating the program in all high-needs schools in our city and encouraging all other principals to enact the program. And when other principals see how well it works in high-need schools, I'm very confident that we'll end up with in-classroom breakfast everywhere in our city. It'll also mean, when I'm mayor, making use of federal school meal options that make lunch free for all students in high-need districts. And it means launching pilot projects of the federally funded school dinner program for those students participating in after-school programming. This is largely federal money that we could be bringing here for New York children. Also means expanding the number of schools offering take-home weekend meals to students receiving free school food. Some schools, to their credit, are doing this already. We should be doing it all over our city for all hungry children. We know, and we've seen it in all the data, as I've said, that food insecure children need our help to be healthy and then also to achieve academically, and I'm prepared to make use of these programs to help children get to their greatest academic potential. 5, children asthma rates. Childhood asthma rates remain seriously high in many neighborhoods across our city. Community-based asthma intervention programs that send health advocates into the home to reduce asthma triggers have been found to be remarkably, drastically helpful in reducing emergency room visits and hospitalization. These are the kind of visits that keep children out of school and force parents to lose time at work. As mayor, I'll develop a program that enables doctors to provide children with a prescription for a visiting asthma prevention program to come to their home. This program will target neighborhoods with the highest asthma levels, help eligible families remove asthma triggers in the home, and teach children to follow a treatment regimen for their asthma. And you know, it's simple things, but you don't really realize it. If your child has asthma, you shouldn't have a lot of stuffed animals in your home. Because even if you're the best housekeeper in the world, stuffed animals gather dust. If your child has asthma, you don't want to have that. There's other really easy trigger tricks, so to speak, that have someone come to your house, they can really help you address this. So I want to thank everyone for being here today. Again, childhood obesity, childhood health care is a critical problem in our city. These 5 steps are going to help make children healthier, make them more focused, and help make sure they can do better in school. It's going to involve public-private partners and hold private entities in our city accountable as well. I'm happy to take any questions on the 5-point plan.